Hello, welcome to Stateline. I'm Ben Knight. Melbourne's intensive care ambulance service is in crisis. That's the finding of a report leaked to Stateline, which shows that mobile intensive care ambulance officers, known as MICA paramedics, are leaving the service in record numbers. The survey shows morale is critically low and relations with management are at rock bottom. Josephine Cafania has this exclusive report.
I felt unsupported by management. I felt no support whatsoever. Scrutiny was becoming constant and more intense. Everything we do is scrutinised. Speaking for myself, my morale was rock bottom. I just had enough, basically, and found another job. But I'm still in touch with friends in the service, and I know that pretty well all, they feel the same way that I do.
Michael Dodds was an ambulance paramedic for 15 years, the last 7 as a MICA paramedic. He loved the job but left the service 3 months ago.
I became very frustrated with the system. The shift work was inflexible. We were on a fixed roster, that is 2 10-hour days followed by 2 14-hour nights and then 4 days off. And that was wearing me out. Physically, I was being worn out by it. The system of dispatch was taking its toll on me as well.
Michael Dodds was one of the state's highly trained MICA paramedics, a specialised group of ambulance officers dispatched to deal with the most urgent of cases. He and an increasing number like him are leaving the service. According to this survey of MICA paramedics, the service is in crisis.
We think it's been looming for some time, and we've seen quite a substantial number of MICA paramedics in Melbourne leave MICA, either go back to be just ambulance paramedics on the road and or leave the Metropolitan Ambulance Service and either move to rural ambulance or interstate or leave the industry altogether. And there's about 20 or 30 of those officers that have left over the last 12 months.
No, it's not in crisis. No, we're aware of concerns with some of the MICA paramedics, and we've been doing a lot of work with our staff to try and address those concerns.
Commissioned by the union Ambulance Employees Australia, the survey of MICA paramedics was conducted last year and found some alarming results. Morale, the report says, is critically low, with many paramedics intending to resign. The report identified the causes of low morale as follows: a dysfunctional dispatch system, inflexible rostering, inadequate remuneration and poor communication and people management by senior MAS management. The report says it is imperative that the management of MAS and the Victorian Government commit themselves to making fundamental changes. Is the system hemorrhaging?
No, it's not hemorrhaging. Victoria's unique in that we actually have 2 ambulance services in Victoria, so some people like a sea change. You know, the rural ambulance has been increasing MICA numbers in some areas, and we've had a movement of staff in, you know, down to the coastal regions, which is quite nice for people who've worked in the system for a long time.
But they say they're leaving because morale is so low and they've had enough.
Look, I think there will be some staff who their morale is low and will leave the system, but what we have to do is we have to get an understanding of why they're doing that.
According to these leaked minutes of a MICA team managers meeting held on the 16th of May this year, just 7 ambulance officers applied for MICA paramedic training. More than 40 are needed. One of the major concerns of those surveyed was the pressure placed on paramedics to meet response times set by the government.
Well, it's all driven by response times. We have to be at the job within a certain length of time, and our response times are measured, carefully monitored, and that's the sort of statistic they rely on. And it doesn't take any other of the variables into account. So we were just sent willy-nilly to almost anything, just so they could say, well, they got the highest level of response in the shortest possible time.
Look, response times is one of our performance indicators to government. So as an organisation, our budget and other things tie into our response time. And the other side of it is that, you know, response time, when we look at patient outcomes, response time is a very important part of making sure that we get to the right patient as quickly as we can.
The ambulance paramedics, the MICA paramedics, are telling us in this report, telling us very clearly that this government is more concerned about statistics than about serving patients. These are life life-threatening issues that these paramedics deal with on a daily basis. We cannot afford this situation to continue.
The report expresses concern at the number of responses that indicate bullying is endemic within MAS management.
No, absolutely not. Look, I totally refute that claim. I think some of it is about a lack of understanding of the management direction, and again it comes back to communication, and we need to communicate better with our staff so that they understand what drives the organisation and where we're going in the future.
Code 1 means lights and sirens to get to the most urgent of cases. But the survey found MICA paramedics have no confidence in the judgments made about when to send out an ambulance on high alert.
For example, and this is a case I actually went to recently, an elderly lady had a nosebleed. 2 ambulances were responded, both with lights and sirens, a MICA unit and a normal road car. We got there and she was okay. Her nosebleed had stopped and she said, "Oh, I did tell them I didn't want any ambulance anymore," but that information doesn't filter through to us.
No, it's not dysfunctional. The dispatch system is a system that's used in about 3,000 different ambulance services throughout the world. It's a very risk-averse system, so we need to, the phone calls are, we're getting information from the public where we can only go on the information provided over the telephone. So we need to be, careful that we make sure we get an ambulance out to cases and treat it as the worst case scenario.
The union says after 18 months of raising serious concerns, a working group has now been established by the Metropolitan Ambulance Service to address issues in the report.
I'm disappointed it's taken this long because we see it as a very serious issue. And hence losing that many MICA paramedics in that period of time, I've never seen that before in my 27 years in the industry.
Look, we're a big organisation and it takes a long time to make change. To recruit and train MICA paramedics takes us over 12 months. So it's one of those things that, whilst we're cognisant of issues, it's going to take us a long time to address them and affect change.
It's an extraordinary proposition to think that the lifesavers who have to attend those dreadful, dreadful situations which they do as MICA paramedics would return to their base and face the sort of issues they're telling us that they face in this report. That's a condemnation of the resources and the management, and it's a condemnation of the approach of the government.
Michael Dodd says while he feels for those MICA paramedics he left behind, he has no regrets about leaving the job.
Once I'd found something to go to, I left with a smile on my face. I'm much happier now I've left, actually.
What are you doing now?
I'm a trainee train driver. And I'm enjoying that enormously.
Well, a spokesman for the Health Minister, Daniel Andrews, says the government has increased funding to the Metropolitan Ambulance Service by $86 million since 1999 and put an extra 467 paramedics and 57 ambulances on the road. Josephine Cafagna with that story.